sharing my screen. Okay, so as being medical doctors working in a functional field, we need to teach our patients how to change their life habits. But we need to do it ourselves first. And sometimes we are not convinced of the things that are happening to the world. So this idea of how to promote longevity with health is in the statements that I did yesterday. This is an introductory PowerPoint slide that I like very much, and that we talk later in the class, talking about functional and integrative medicine with something that we call bioregulatory. So we need to make our patients understand that we are not seeing one part of them, we are seeing the whole person. So we need to introduce diet, we need to introduce supplements, orthomolecular vitamins and probiotics and phytochemicals. We need to introduce the emotional and mental part, including the stress management techniques, including the physical techniques like osteopathic manipulation, acupuncture, also things like Tai Chi and touch healing techniques and yoga and breathing techniques. We need to introduce our patients to grounding techniques to help our patients to connect again with nature. And then, of course, some devices like electromagnetic stimulation and photobiomodulation. And of course, sometimes we need to say our patients that they need a surgery. So this is a complex world, and the world that we live today is also a little bit of complex and complexity. So this is a strange world where in some regions of this green circle with a yellow sun, sometimes we cannot see the streets and people cannot see themselves through the buildings. And actually, in some cities in the world, there are more cars than people, and sometimes there are more planes than countries. So we are going ahead to a heavy polluted air, and these cars and the trucks and the planes and the industries, the fabrics, have increased the number of deaths in the last 25 years by 55%. And what we call global pollution has killed or is responsible for the death of more than 9 million people per year in the world. Also, the question of the drinking water. We must teach our patients that they need to buy drinking filters to put in their houses, that it's a good investment, because the water that we drink in our houses have arsenic, fluoride, nitrate, and also microplastics, pesticides, and some kind of pharmaceutical medication, like, for instance, Prozac, the antidepressant drug is so used in the United States that in some regions, the water that comes from the tube has this drug. Also, the indoor pollution. So we know today that the indoor pollution is more significant than the outside pollution. So we have this belief that we are protected in our houses, but especially the cooking smoke, the cleaning products from the kitchen, the mold in the bathroom. In Portugal, we don't have a lot of mold disease, but some countries like the United States have mold disease, so we need to pay attention to this, especially people in patients that live in old houses. So we also need to ask them where they live and if the house is new or not. The perfumes, the nail polish, the furniture, especially this low cost furniture that is with IKEA widespread in Europe. It's very common. And of course, the poor ventilation, because of sometimes where the house, the air outside is so cold, people tend to not ventilate their houses. The question of the electromagnetic radiation, this is a epidemic disease in the world that we live. We know today that the COVID situation was worsened because of the peaks of electromagnetic radiation where it started. So we also need to ask our patients how many mobile phones they have, iPads, computer, if they are seated in the computer every day, in their houses, if they have routers, if they have cable, if they have TV in the bedroom. And of course, these electric cables going through the houses is very important. The question of the pesticides, so we know this is a widespread and indiscriminate use of pesticides, biocides, herbicides, and insecticides. Like we talked yesterday, we know that the patients are contaminated with this, so we need to ask them to buy biological organic products. The question of the phones, the mobile phones, we have more phones in the world than people, and what we call stress. This is an invisible line between working and being parents and being sons of old people, as we are in the mid 40s, and working as per the demands that ask us. This is something that we cannot prove. We need to talk to the patients to understand how they are living their lives. And something very important is that we can make some hormonal analytical levels of cortisol, for instance, but sometimes it does not show us the actual burnout in where we see a lot of patients. Also, the questions of cosmetic and personal care products. This is a very important issue, because when we had this EGL lab of the filter, the plasma filter of the apheresis, we show patients that it showed in their blood after filter that they have some hazard ingredients. Where they went to their houses, they saw that the ingredients was in cosmetic products, especially ladies. Also, what we use to clean our houses, some chloroform products are carcinogen, some phthalates that are endocrine disruptors. This is very important because this can harm especially young children. Also, the dishwasher detergent, this is a study from February 2023, where it is shown that these detergents, when they go to this high temperature of the water, they promote this leaky gut in the epithelial barrier of the bowel. So we need to show our patients that they cannot use these kind of products. Like we also talked yesterday, the dental fillings can be toxic, especially the dental fillings with amalgama, with mercury, but also resin fillings, also some titanium implants, and we need to be prepared to make hypersensitive tests to our patients when we suspect that something can, some disease can come from there. The toxic metals, of course, we know tobacco, I don't have to tell you this, vaccine ingredients, and this new disease called microplastics and plasticides. This is a 2023 article where it shows that the microplastics come from ingestion, straight ingestion from the food, from the water, then also from inhalation, and the newborns, especially from the mother's milk. So we know that the mother's milk has microplastics that goes to the babies. And the indoor exposure to microplastics is 8 times higher than the outdoor exposure. In the food, as we said, in drinking water, and these paper cups, where we put hot water, where we put coffee, where we put tea. And so they have heavy metals, and also they have microplastics. This is very, it's very, for me, it's very sad, because I believe that we don't know in which world we are living. And for instance, we know that the average intake of microplastics is 0.03 per kilo. So it's more or less 7 grams per week. So more or less a Visa card that we ingest per week of microplastics. Also in the tea bags, this is a very important situation, because we get used to these tea bags. It's more practical than the actual flowers to make a tea. So we know today that tea prepared with tea bag herbs is a risk, because they have microplastics and esters phthalate that are released with the hot water. Also, these plastic shopping boards that are so easy to clean, and they came to replace the old ones from wood, they are a substantial source of microplastics in our food. So, let me breathe. Because adding to this, the less contact with nature, the less social interaction, the stress, anxiety, depression, especially after COVID, this loneliness, this sadness that is widespread, like a world vaccine, has put us ill, like we said yesterday, the chronic diseases. So they come from toxic overload and the vitamins and minerals deficiencies. So what is making us sick? This is a very interesting review from the Journal of Environmental Public Health from United States, that show us that the toxic substance, they bioaccumulate in men, human children, and of course babies when they are in the babies of their mother. So this was the way that we saw the disease when we were sorry. This was the way that we learned to see a patient. So this is the common algorithm. We see a patient, we assign a diagnosis, we do a therapeutical intervention, and then the patient lives with this chronic illness. So we are not used to put toxins and vitamins deficiencies in this. This is very important because we need to shift to the paradigm where we see a patient, we see a disease, and we need to sum all these etiological factors, of course, like the genetics, like the bacteria and viruses and parasites and whatever microbiological immune system that the patient has, the emotional part, but also the toxic overload and the deficiencies of vitamins and minerals. So the impact of the extracellular matrix with inflammation, with oxidative stress, is one of the reasons why we talked yesterday about ozone therapy, about therapeutic aphoresis, because we know that what we do is we cleanse this expression, this inflamed extracellular matrix. This is a very interesting article from 2019 that shows us that in cancer, the abnormal remodeling of the extracellular matrix is what drives disease progression because of this complex cell extracellular matrix interaction. And this is one of the cases that is proof that the abnormal remodeling of the extracellular matrix is very complex. And if we start cleansing the blood by a plus and less algorithm, the extracellular matrix puts in the blood what is toxic in it. So this is a good article that shows us that what we have been talking in the last 20 minutes about the environment and about the toxic overload that we have is already proven. Of course, in diseases like asthma or chronic degenerative pulmonary obstruction is very easy. But for instance, in obesity, we know that tobacco smoke and bisphenol A during fetal, when the baby is in their mother wombs, can lead to an obesity later in life. So this is a very interesting article that shows us, for instance, that metabolic syndrome, when the baby is exposed to endocrine disrupting chemicals, can lead later in life to a metabolic syndrome. And let me show you this. For instance, a low IQ. No one wants to have a baby and a child, and then the baby doesn't have smart brain. So we need to teach the mothers to not to be exposed to heavy metals, to stop smoking at least 6 months before, to not to be exposed to pesticides. This is very important when we are talking to our patients, and also to prove them and to prove to ourselves, if we are not convinced enough, that the detox, like we talked yesterday, and the changing of the behaviors that we have is a low cost, high efficiency intervention. So the chronic inflammation, the silent inflammation in the etiology of disease across the lifespan is very important to put the xenobiotics, the industrial chemicals, the waste products, the air pollutants, and this can promote and keep on promoting this low-grade inflammation that is on the base that the majority of chronic diseases. If you don't know about this article, this is a very interesting article showing us like a wheel that physical inactivity, obesity, leaky gut and dysbiosis, pro-inflammatory diet, chronic stress, insomnia and xenobiotics lead to this chronic inflammation that per se can lead to these chronic degenerative diseases like diabetes, cancer, and depression. So this is exactly what I just told you about. And of course, when we see a patient having obesity, having a pro-inflammatory diet, having stress, having insomnia, and yet doesn't have any cancer, doesn't have any diabetes, doesn't have any cardiovascular disease, we need to tell them that what they have is a functional disorder. So functional medicine and functional disease is a group of syndromes and disorders where the symptoms have yet not been related to a primary biomedical pathology as we learn in medical school. But if we ask our patients enough questions, we will explain them that they have a functional disease, and if they don't change any behaviors, that will lead to a known disorder. So like we talked yesterday, let's do these medical treatments where the toxic overload and the vitamins deficiency enters as etiological and promoters of the disease, but enters a new access point where the body has its own regulatory availability, and we need to restore this capacity of the body to return to a health status. We were taught to think in a line: bacteria, infection, antibiotic. But we are functional doctors, so we need to know that our body, our nature, operates in terms of a network. So that's what that is the explanation of the news proteomics, the news metabolomics. It begins with this explanation, where in fact we put everything that can influence our health, and we see it in terms of networks. So when we think like this, thinking in terms of network, also the diagnosis will lead us to a different therapeutical approach, and this is very important. For instance, the neuroendocrine network will stabilize the inflammatory network. Sorry, this is in Spanish. So for instance, a patient that had asthma will have later in life Crohn's disease, and maybe it can have arteriosclerosis disease. So the point where the disease starts is not the point where we see the patient. We catch the patient in a late clinical stage of the disease where it has multi-morbidity and complications. And we need to go backwards to see what risk factors led to where we are right now. And of course, sometimes where it enters our our blood tests and urine tests. So this is what we call the bioregulatory system, and this is now easier to understand if you didn't ever saw this slide. So to resume, we have these hallmarks of health: This is an article from 2021, very interesting article, that show us that the response of stress or misregulation, and also not only psychological stress, but also toxic stress, because sometimes I can eat something that make me sick, but I don't do it every day. I can go to a wedding, or I can eat some cheese, or I can eat some gluten, and I know that I will have an inflammatory response, but I don't do it every day, so it doesn't accumulate. So my body can be in response to that, let us say, stressful situation. So this is how we can promote this longevity, where we will not only give medicine, but we will teach our patients to be interested themselves in the human body, in the diet, in the causes and prevention of the diseases. And this is what we saw yesterday also. So we need to go from a aging, from a bad aging, to a longevity status. And this is important to see the age-related disease as also a immune modulation, and also can be promoted or be helped by rejuvenation. So this is a slide telling us about the exposome. This is what we have been talking about. This is not new. So the sum of every toxic and everything that happens to us. I always draw this line to the patients, because they need to understand that since they were in their mother's womb, they were being like in a glass that we go and fill and fill and fill until it goes out and the disease appears. So promoting changes in the behavior is part of the treatment, and each one of us is responsible for the return to a state of full health. Of course, state of full health is more than the absence of symptoms. And for instance, you are in South America, Central South America country, and these kind of countries like Costa Rica and Brazil and Argentina and Africa, in Portugal, we receive a lot of patients from Africa. Of course, the patients that come here to the clinic are patients with money, but we always talk that some of the things that we are saying, that I am saying here, are very cheap. So this can have cheap interventions to the public, and each one of us is responsible to go from aging and disease phenotype to a health and longevity phenotype, where we can meditate and have sun. That's why you went to Costa Rica, to have sun, to relax in the sea and the sand, also to eat well, to go out and give a walk in the beach, so make some exercise, and of course the orthomolecular supplementation. So in resume, what can we do? We can promote high quality nutrition, especially biological, organic nutrition, caloric restriction and intermittent fasting, physical activity, orthomolecular supplementation, stress management, sun exposure, avoid the pollution and the toxic in general, and microbiome regulation. Let just show you some new interesting articles that prove, for instance, this article was after COVID, that prove that our diet with high sugar, high alcohol, high sodium, potassium, salt, leads to caloric increase in caloric intake and visceral adiposity, and also to dysbiosis that makes the wheel go round, with endotoxemia in the blood. So this makes the inflammation, silent inflammation, this makes the oxidative stress that leads to a activation of this phenotype. If we only could replace 10% of daily caloric intake of beef by fruits, we could earn 48 minutes per person per day of health improvement. This is very interesting. And also, of course, this is not how can I say, the goal of this Congress, but also a 33% reduction in the carbon footprint. So only 10% of caloric intake of beef. Of course, you know this, higher frequency of organic foods was associated of a reduced risk of cancer, not only by the organic food itself, but because a person that search for organic food is a person that is more interested in promoting health and avoiding disease. About the fasting, we did not speak about fasting yesterday. I don't know if you have any lecture in fasting. So this time control fasting that leads to a low glucose insulin in the bloodstream that will eventually lead to a metabolic flexibility. So this is what we call hormesis, and this hormesis allow us to be more protective of aging. Physical exercises above 150 minutes per week, so a little bit more than 2 hours, but less than 2,000 minutes. So not high exercise like a pro-inflammatory competition athlete, but a mid exercise. It was what the goal of physical exercise in promoting longevity. What I like the most is this one that says that the exercise helps the mitochondrial dysfunction by making the DNA shifting higher and stimulates proliferation of different types of stem cells. So this is a cheap treatment, cheap longevity treatment. Nutraceuticals, yesterday we were talking about IV orthomolecular supplementation. This is orally, so vitamin D is an amazing pro-hormone, expected and dreamed to be anti-aging medicine. Vitamin C, vitamin E are, of course, antioxidant vitamins. But we doctors are taught in college that we don't need to prescribe supplements and vitamins to our patients, telling our patients that the fruits and the vegetables that we eat today are less in vitamins than they were 50 years ago is very helpful in promoting them to buy the vitamins and to take the vitamins. This is what we just talked, but this is a new article from 2024 that shows the prenatal exposure to air pollution and the high risk of depression after the child delivery. And what about the sun? We were taught to put sun barrier creams, and this has led to insufficient sun exposure that was responsible for 340,000 deaths in the United States and almost 5,000 deaths in Europe per year, with increased incidence of breast cancer, hypertension, cardiovascular disease, and especially because of the low level of vitamin D. So, working as functional integrative doctors is a good way to keep us always in the line. People search for us with diseases, chronic diseases, and sometimes very bad shape patients. And as we talked yesterday, the way that the world is today is making us sicker and sicker. And I believe that the majority of the people there are more or less of my age. So if you work in integrative or functional medicine before, I'm sure that you have realized that now people are much sicker than 5 years behind. People now are sicker than before COVID. And this is a sum not only because of the COVID vaccination problems, but also because of the isolation that the pandemic went us through, and because of the pollution that was in a higher level after the COVID pandemics. So teaching our patients these risk factors and the way that they can change their behaviors is a very good way to make in a cheaper early risk intervention to help our patients have a good longevity, avoiding chronic diseases as they age. And if you have any questions, I'm available.